Hello everyone, I'm Dr. Jason Fung. Today, we're going to explore the top 10 foods that can actively support the healing of your kidneys. Right from the start, we need to clarify a major point of confusion. Typically, when people discuss a kidney diet, they talk about it as if it's a single universal plan. However, and the strategy makes a world of difference depending on what stage of kidney disease you're in and what our ultimate goal is. You see, the standard dietary recommendations, what is conventionally labeled a kidney diet, focuses primarily on restricting certain elements. And this approach has nothing to do with actual healing. What they are really talking about is damage control for advanced cases. Because the kidneys aren't functioning properly, we have to limit certain substances so that toxins don't accumulate too rapidly in the bloodstream. Now, when we shift our conversation to genuine healing recommendations, when we are actually attempting to repair the kidneys and restore them back to a healthy state, we are discussing a completely different strategy. When medical professionals classify kidney disease, they divide it into distinct stages from 1 through 5, with stage 3 also having an A and a B classification. And this diagnosis is primarily based on a biomarker called creatinine. As you may know, your kidneys filter hundreds of liters of blood fluid every single day. Along with that, water passes virtually everything that is dissolved in it, except for very large particles like red blood cells and certain proteins. So, elements like sodium, glucose, and creatinine all get filtered out with the water. However, the kidney then reabsorbs everything the body considers valuable. Glucose, for instance, gets reabsorbed at nearly 100%, assuming a person isn't diabetic. Sodium is reabsorbed at over 99%, but creatinine gets reabsorbed at 0%. Therefore, if creatinine levels in the blood begin to rise, it indicates that the kidney's filtration flow is not optimal. There isn't enough fluid moving through the kidney's filtering units. This filtration rate is measured in milliliters per minute and is called the estimated glomerular filtration rate, or EGFR. Doctors estimate this based on your creatinine level. If you're filtering 90 milliliters per minute or more, you are either completely normal, or you could have a kidney issue classified as stage 1 that isn't related to filtration volume. It might be that a urinalysis shows protein in the urine, for example. If you are filtering more than 60 but less than 90 milliliters per minute, you're in stage 2. A somewhat ironic point is that this is often still called normal on standard blood test reports, meaning you could be in stage 1 or 2 and your results might not be flagged, as the cutoff for concern usually begins at 60. The next stage drops to 45, which is stage 3A. Then we go down to 30 milliliters for stage 3B. If your EGFR is between 15 and 30, it's classified as stage 4, and if it falls below 15, that is stage 5 or end stage renal disease. At this point, a person is very close to complete kidney failure, and typically dialysis or a transplant become the only viable medical options. Now, on average, about 15% of the general population has some degree of kidney compromise, placing them in one of these stages. That translates to roughly 1 in 7 people worldwide. Out of that 15%, only about 1% are in stage 5, which is a very small percentage. If we include stage 4, that brings us to about 3%. So, stages 4 and 5 together represent about 4% of that original 15%, meaning they still constitute less than 1% of the total population. These are the individuals who really need to be exceptionally careful, following clinical guidelines very strictly and avoiding a range of dietary substances. Then we have the other side of the spectrum. Those in stage 1 don't really have this filtration problem at all and don't need to avoid anything from a standard kidney diet perspective. Those in stage 2 also don't need to restrict anything in terms of that conventional diet. Instead, they need to begin addressing the root cause, whatever that may be, which we will discuss. This group, stages 1 and 2, comprises about 50% of all people with some kidney compromise. Within stage 3, 3A is twice as common as 3B. So overall, we have about 20% of people with kidney issues who need to pay close attention to dietary restrictions, stages 5, 4, and 3B. However, the remaining 80% of people with kidney disease find that the traditional kidney diet really doesn't apply to them at all, because that diet is about restricting things the kidneys are failing to eliminate, and their kidneys are still capable enough. With stage 5 kidney disease, Where the eGFR is less than 15, there is major significant damage. Anyone in this stage needs to be under the care of a nephrologist, a kidney specialist. If someone gets blood work back indicating this stage and they are not already working with a specialist, they need to see one immediately because they are very close to kidney failure. This is the most extreme scenario for limiting dietary intake. They need to restrict virtually everything sodium, potassium, phosphorus, and also nitrogen, which is a byproduct of protein metabolism. They might even need to limit water intake because if the kidneys are filtering so poorly, you must be cautious with almost every substance you consume. This leads to a huge and critical point of confusion. Just because a person with kidney failure needs to avoid these things does not mean that these nutrients are the last cause of the disease. Instead, these are essential resources. We need minerals, we need protein, we need water when we are healthy to prevent kidney disease from developing. And if we have a mild case, we need these very same nutrients to valor reverse it. We must be perfectly clear on this because it's a common mistake to assume that if we have to limit something when the kidney is damaged, then it must have been the cause. Nothing could be further from the truth. We need these building blocks to heal. And of course, the most important strategy is always prevention, making positive lifestyle changes long before you ever get anywhere near this point. Our first food to evaluate is a red grapes A. The question is this a good food for kidney health? I've compiled a list of 25 foods that are frequently recommended for kidney patients, and we're going to go through them to determine if they are truly beneficial. The reason given for red grapes is that they contain antioxidants and have anti-inflammatory properties. That might be a positive attribute, but it's somewhat irrelevant to the specific mechanics of kidney healing or its filtration capacity. We also want to examine factors associated with kidney problems like phosphorus, potassium, sodium, and I've added sugar to the list because most people don't associate sugar with kidney issues. We'll discuss why that is shortly. Red grapes would be a good food based on phosphorus, potassium, and sodium as they are quite low. But that sugar content is far too high, and we'll talk about that next. So, for red grapes, we give it an X. We do not want this on a true healing kidney diet. To understand why, we need to grasp the root causes of kidney disease. The number one cause is type 2 diabetes. After that, we have hypertension as a very close second, followed by kidney infections in much smaller percentages. Certain medications can also cause kidney damage, particularly over-the-counter drugs like non-steroidal anti-inflammatory drugs and NSAIDs. And these are pain relievers and cold flu medications you can buy without a prescription, and you don't want to use them unless it's absolutely necessary. Then we have conditions like lupus, an autoimmune disease. Many people are familiar with rheumatoid arthritis that affects joints and bones. Lupus is a similar autoimmune process, but it targets soft tissues, and the kidneys are often one of the primary organs attacked. We could also have poisoning from heavy metals or environmental chemicals that can directly injure the kidneys. Many pesticides and high doses of industrial chemicals can create significant problems as well. The reason I emphasize sugar in addition to the traditional criteria is that the number one by a huge margin contributor to kidney disease is type 2 diabetes. Not only that, but diabetes is also the primary driver for hypertension. So, if we can effectively manage the insulin resistance that causes both type 2 diabetes and high blood pressure, we have likely eliminated about 90% of all kidney disease right there. The second food is as apples. The reason typically given is that they are high in fiber and antioxidants, a mantra we hear constantly, and also a good source of vitamin C again. And these could be good general health attributes, but they aren't directly going to aid the kidney's core function. If we look at phosphorus, potassium, and sodium, they are very low, which would seem positive. But again, that sugar content is somewhat high. Does this mean apples are a bad food? No, not at all. But if we are trying to reverse kidney disease and insulin resistance is the most common underlying factor, then we are probably not going to successfully reverse insulin resistance and kidney disease if we continue to consume significant amounts of sugar. For someone who is very metabolically healthy, they might be able to tolerate a few apples and other fruits without issue as long as they are aware of their metabolic status. Therefore, I would put a question mark here. It depends entirely on the individual's health and the quantity consumed. For most people, however, and since most chronic kidney disease is rooted in insulin resistance, we are not going to place apples on our recommended list. Number 3 is onions. They are often recommended because they provide robust flavor without adding a lot of potassium. Let's see if that holds true. The numbers look good for most metrics. Potassium isn't too high and the sugar content is negligible. So, as long as you aren't consuming an entire meal of them, like making onion soup and eating a pound or two, you likely won't have a potassium issue. Given how most people use onions as a seasoning, this gets a check mark. Number 4 is Aya's cauliflower, which is one of my personal favorite foods that I eat regularly. The recommendation is that it's low in potassium and a good source of vitamin C and fiber. Let's verify that. Phosphorus is low, but potassium is 299 mg per 100 g. In my view, that isn't really a low potassium food. On the contrary, I often tell healthy people that cauliflower is a great source of potassium, and 299 is a fairly substantial number. Not only that, but consider how much of it you can realistically eat. Cauliflower is a low-carb, water-rich food, so there's a potential to consume a large volume and get a ton of potassium. If you have a tiny portion as a side dish, you're probably fine. But we're going to assign a question mark to this one. What does the question mark signify? It means an element here is relatively high, so it depends entirely on the portion size. Let's say you make mashed cauliflower as a potato substitute. It would be quite easy to consume 1 pound, which could deliver around 1,500 milligrams of potassium. Is that a lot? Let's put it in context. If you're in stage 3 or 4 kidney disease, indicating moderate to severe damage, standard guidelines suggest restricting sodium to less than 2,000 mg, though I don't necessarily agree with that rigidly, phosphorus to less than 1,000 mmg, and protein to between 60-80 g, which is on the low to moderate side. Potassium is so crucial because if your kidneys can't eliminate it efficiently as it builds up in the blood, it can slow down your heart and, in extreme cases, stop it altogether. This is absolutely something we want to avoid. For stage 3A, it's often considered that filtration is still sufficient to handle potassium. For stage 3B, the recommendation is to limit potassium to 3,000 mg per day, and for stage 4, to less than 2,000 mmg. So if you were trying to heal your kidneys with a keto diet, which isn't a bad idea, and you ate massive amounts of cauliflower, you could easily exceed those limits, especially when combined with other foods in your diet. It's vital to understand that even with these restrictions in place for damage control, there is still hope. The kidney retains some regenerative capacity if we start implementing the correct healing strategies. Number 5 is garlics. The justification is that it may possess anti-inflammatory and antioxidant properties. Garlic is a powerful medicinal herb that shows up in many health contexts, and it is indeed very potent. I don't foresee any problem with consuming it for a variety of health reasons. Looking at the mineral content, phosphorus is somewhat high, and potassium is quite high, while sodium and sugar are very low. However, we must remember that garlic is not a food you consume in pound quantities. If you have a couple of cloves or even a whole bulb, you won't ingest enough for the potassium to become a genuine problem. On that note, I should also mention ginger's, which is very similar in its medicinal, antibacterial, and antifungal properties. Again, you're only going to consume a few grams or an ounce at most, so it's not a concern. Therefore, we put a check mark on both garlic and ginger. Number 6 is cabbagey. It's said to contain phytochemicals with anti-inflammatory properties. Again, that's likely a good thing and may assist the kidney slightly in healing, but from a strict kidney diet filtration perspective, it's largely irrelevant. When we examine the nutrients we might need to avoid, they are all very low. So we don't have a problem with cabbage. If you went on a cabbage soup diet where that's all you ate, that might create issues, but for normal culinary use, it's perfectly fine. Number 7 is cherries. The claim is they have antioxidants and anti-inflammatory properties. You can hear how most of these foods come with the same generic reasoning, as if people are just repeating a mantra without understanding the specific why. We want to understand the underlying reasons so we can make the right choices for our unique situation. Phosphorus is low, potassium is a bit elevated, but the major concern here, once again, is the sugar content. If our goal is to reverse insulin resistance, a root cause of most kidney problems, then cherries are not something we want to consume in large quantities. Number 8 is bell pepper. The recommendation is that it's low in potassium and high in vitamins A and C. The red and green varieties have slightly different profiles, but the one that stands out as potentially getting high is potassium. If you just have a few slices in a salad, it's not a problem. But if you make a large stir fry or fajitas loaded with bell peppers and onions, you might push your potassium intake a bit too high. The green pepper is a slightly better option if you are strictly restricting potassium. So, we'll give it a question mark. It's probably alright for most people, but the question mark is a reminder that the portion size is key. Number 9 is berries. They are recommended for being low in potassium and a good source of vitamin C and fiber. I personally love berries. Let's see how they measure up. The numbers are quite low across the board for raspberries, and strawberries are similarly low. This makes them a great food. If you're trying to reverse insulin resistance with a low carb or ketogenic diet, you can still enjoy a handful of berries. Now, if you worked on a berry farm and sampled one for every one you picked, you could potentially overdo it on both sugar and potassium. But for a moderate handful, you're going to be just fine. So we give check marks to these berries. The 10th commonly recommended food is egg whites. The reasoning is that they are a low phosphorus source of high quality protein. Let's talk about that. Egg whites do have very favorable numbers here. However, I always advise people that you don't really want to eat egg whites by themselves because nature packaged the whole egg for a reason. When you consume the whole egg, you are getting considerably more phosphorus, which could be a problem, but the other nutrient numbers are still good and the sugar is a non-issue. So, once again, it depends on your situation. Someone in stage 5 or 4 would probably be advised to eat just the egg whites, while anyone else would benefit from eating the whole egg for its superior overall nutrition. The only potential issue is that the phosphorus is a bit higher. I'm still going to mark this with a question mark. They call it a high quality protein, but we need to understand that when you isolate the egg white, you are only absorbing and utilizing about 1/3 of its protein potential. It's a myth that it's this fantastic protein source on its own. If you can, you should definitely eat the whole egg. But the question mark remains because if you're on a keto diet to heal your kidneys and reverse diabetes, and you're eating 10 to 15 eggs a day, you might push your phosphorus intake too high. If you have that issue, you'd want to limit yourself to a more moderate number, like 2 to 4 eggs. Number 11 is as olive oils. It's praised for containing heart-healthy monounsaturated fats, and I completely agree. I would recommend specifically extra virgin olive oil, and even better if it's organic, as it's become quite affordable. Looking at the minerals, phosphorus, potassium, and sodium are virtually zero. But I want to highlight a huge common misconception. Olive oil, which is technically a plant or fruit oil, contains 16% saturated fatty acids and 74% monounsaturated fatty acids. It is most often compared to other vegetable oils, with the claim that it's healthy in those are too. In fact, the fat profile of extra virgin olive oil is much closer to beef fat than it is to other seed oils. Beef fat actually contains about 42% monounsaturated fats, the ones we know are heart healthy, while its saturated fat is obviously higher because it's a solid animal fat, just like humans store fat. These two fats are much more closely related than olive oil is to other plant oils. Overall, olive oil definitely earns a check mark. Put it on everything. Number 12 is pineapple. The claim is that it contains bromelain, an enzyme that may have anti-inflammatory effects. Again, that might be beneficial if inflammation is part of the kidney issue, but it's irrelevant to the filtration-focused kidney diet. The mineral numbers are very low, but the sugar content is far too high. You do not want this on a kidney-healing diet. Number 13 is his other's cucumber. It's recommended as being low in potassium and a refreshing option for hydration. I would agree it's very fresh and has extremely low numbers across the board. I have no problem with it at all. Enjoy your cucumber. Number 14 is asparagus. Again, we hear about antioxidants and anti-inflammatory properties, that same repeated mantra. And again, the numbers are very favorable, similar to cucumber. It gets a check mark, even though it's not a personal favorite of mine. But if you enjoy them, go for it. Number 15 is as a skinless chicken. The recommendation is that it's low in phosphorus and high in protein. Skinless chicken does have numbers that are not super low, but are relatively low. Because it's a concentrated food, you won't eat as much volume as you would with water-rich vegetables. But why would you choose skinless chicken over chicken with the skin? Unless your goal is for it to taste less appealing, the whole chicken with skin has more fat, which is why they tell you to remove it. In fact, the two nutrients of concern, phosphorus and potassium, are actually lower in whole chicken. Also, because the whole chicken is more satisfying due to its fat content, you're likely to eat a slightly smaller portion, thereby better controlling those numbers. I give this a question mark because its suitability depends on how much you eat. I don't recommend skinless over whole chicken. You can definitely eat chicken, it just matters how much you consume. Next, we have SS cranberries. They are said to help prevent urinary tract infections. Cranberries are very frequently used for anything related to the urinary tract, like bladder infections, and there is some evidence, largely anecdotal, that they can support the health of the kidneys and bladder. Now let's look at the numbers. The mineral numbers are really low, but even though the sugar isn't extremely high, I'm putting a question mark here. Why? Have you ever tasted a raw cranberry? They are intensely tart. The only way most people consume them is loaded with sugar, like with a Thanksgiving turkey, or they hear about cranberry juice being good and buy a sugary version from the store that's almost as bad as soda. You don't want to do that. However, there is a way to get the benefits. You can buy a concentrated, unsweetened cranberry juice extract. You only need a teaspoon in a large bottle of water. It's pretty expensive, maybe $30 for a small bottle, but it lasts a long time. You can then sweeten it with a safe sweetener like stevia. This way, you can potentially get the benefits without the sugar overload. Number 17 is sexa buckwheat. It's promoted as a whole grain that is a good source of protein, fiber, and nutrients. What do the numbers tell us? Phosphorus is quite high, potassium and sodium aren't bad, but the phosphorus could be a problem if you eat a lot of it. Since it's a grain and a concentrated food, you're probably not going to eat an enormous volume. But we must remember that most kidney problems are tied to carbohydrates and insulin resistance. You are essentially carbohydrate intolerant. If you're trying to reverse that condition, you do not want to eat something that is 72% carbohydrate. So it gets an X. Number 18 is SA eggplant. It's said to be low in potassium and a good source of dietary fiber. We keep hearing these same general points. The numbers look fairly good. Potassium at 229 mg is the only thing that stands out a bit. If you're just having a small amount in a dish like Thai curry, it's not a problem. But if you use eggplant as a main ingredient, like in a casserole or a primary dish, it could easily contribute too much potassium. We'll put a question mark here. Number 19 is Tsar's green beans here. The story is pretty much the same, low in potassium and a good source of fiber. The numbers are very similar to eggplant. Same principle applies. If you're a green bean enthusiast eating them by the pound, it could add up, but for normal consumption, you're probably fine. Number 20 is isi fish. It's recommended as an excellent source of omega-3 fats and high-quality protein, and I totally agree, it's a fabulous food. Taking salmon as an example, we see that phosphorus and potassium are at reasonable levels. You are not going to eat salmon by the pound. A typical serving is 4 to 8 ounces, about 100-200 grams. It's a concentrated, satisfying food, so there's no problem there. But if we include fish as an excellent protein source, we should definitely consider beef as well. It's just that saturated fat myth we've been told that unfairly maligns it. In fact, when it comes to the nutrients we monitor for a kidney diet, beef actually looks slightly better in these comparisons. So we're going to give both fish and beef a check mark. So when is there still genuine hope for improvement rather than just managing the consequences and toxic buildup? With stage 5, unfortunately, it is probably too late in most cases. There isn't a lot of regenerative potential left when the damage is that extensive. However, this affects a very small percentage of the population, and we want to understand this so we never let it progress to that point. If you are in this stage, you absolutely must work with a nephrologist who can meticulously measure your levels, monitor your kidney function, and advise you on when interventions like dialysis or a transplant are necessary. When it comes to stages 3 and 4, the odds are significantly better. Stage 4 will undoubtedly be tough, but it is possible to make positive changes. The specific cause also matters. If it's due to lupus, an autoimmune condition, it may be more complex to address than if it's rooted in insulin resistance. If insulin resistance is the driver, the path is more straightforward. Reverse the insulin resistance and diabetic condition. This is achieved through strategies like a low-carb or ketogenic diet and intermittent fasting. There are also some very powerful supplements we will discuss. For those in stage 2 where kidney function is still reasonably good and no major dietary restrictions are needed, improvement is typically quite straightforward. Regarding supplements for stage 5, there is a possibility they could offer some support, but I wouldn't recommend self-prescribing. It's crucial to work with a knowledgeable professional who can monitor your situation closely, perhaps using methods like muscle testing to determine what your body specifically needs. This should be in addition to, not instead of, working with your nephrologist. For stages 3 and 4, however, there are some exceptionally powerful supplements. In clinical practice, I've found a few that stand out above the rest and can provide significant help. These are Renefood from Standard Process, Renatrofin PMG from Standard Process, and Arginine. What do these do? Well, arginine acts like a drain cleaner or a roto-rooter for your circulatory system. It helps improve circulation, break down oxalates and stones, and is great for gout. It also helps move any debris that can get lodged in the kidneys. It contains enzymes, and while the ingredient list doesn't tell the whole story, its activity is broad. Renatrofin PMG helps repair tissue, which is especially crucial if there's an autoimmune attack on the kidneys, but it's beneficial for any tissue destruction. Renefood is a comprehensive combination that includes both Renatrofin PMG and arginine, plus additional nutrients for kidney support. Regarding dosage, I wouldn't recommend just going out and taking huge amounts blindly. In my clinical experience, if you have significant damage as stages 3 or 4, you will likely need a higher dosage than the label suggests. You might try taking all 3 together, perhaps 6 to 12 Renefood, 6 to 12 Renatrofin PMG, and 6 to 12 arginine. It's always best to have a professional help you determine the optimal dosage. If you are in stage 2, I would typically just start with Renefood, using the base recommendation of 3 per day, unless testing indicates otherwise. Number 21 is Casera asparagus. It's said to contain antioxidants and be low in potassium and phosphorus. The numbers show low phosphorus and reasonably low potassium. So, again, it depends on the portion. 3 spears on your plate is no issue, but eating it by the pound would require caution. Number 22 is celery. The claim is that it's low in potassium and anti-inflammatory. The numbers show it's not exceptionally low in potassium. Having a few sticks with your meal is fine, but if you get into the trend of juicing large amounts of celery daily, you could quickly build up your potassium intake, especially if you need to restrict it. If you just eat it whole, you're unlikely to have a problem. Number 23 is ask kale. It's promoted as a nutrient-dense leafy green that is low in potassium. The data shows it's not particularly low in potassium. However, it takes a lot of effort to eat 100 grams of raw kale in a salad, so it would be difficult to exceed limits that way. But if you juice it, you could concentrate the potassium. I should add that juicing straight kale can be quite harsh on the system. I tried it years ago during a cleanse, and it wasn't a pleasant experience. Eaten in a normal salad, it's totally fine. Number 24 is quinoa. It's described as a protein-rich grain that is low in potassium. Let's see per 100 grams of dry quinoa. It has high phosphorus and high potassium. Since 100 grams of dry grain makes a sizable cooked portion, these numbers are not low. We're looking at over 500 mmuz of potassium per serving. But my primary concern, once again, is the carbohydrate content. If you're trying to reverse kidney disease, you usually need to lower your carb intake, and eating something that is predominantly carbohydrate is not a great strategy. so we will not put quinoa on the list. Number 25 is as watermelon. People love to put this on every health list. It's said to be high in water content, helping with hydration, and low in potassium. Let's examine the numbers. Yes, phosphorus, potassium, and sodium are quite low. The sugar content of 6 g per 100 g doesn't look terrible on the surface. It's similar to onions in a way. But the critical question is, how much of it would you typically eat? Could you eat more watermelon than onions? Absolutely. The other clue is the helps with hydration claim. To get meaningful hydration from it, you couldn't just have one small square. It's incredibly easy to consume a pound or even 2 of watermelon. At that level of consumption, the potassium could become significant, and more importantly, the sugar intake would be astronomically high. So we're giving watermelon an X. When it comes to kidney health, dietary restrictions, and recommendations, we must fundamentally understand the difference between addressing the as cause and implementing ear damage control. If we want to heal, we must target the root cause. However, most of the conventional kidney diet is solely about damage control, limiting the substances that failing kidneys can't excrete, thereby reducing toxicity in the body. This diet has its place, but it applies primarily to those with chronic kidney disease in stages 5, 4, and 3B. That's only 20% of all people classified with kidney disease. For all the others, our focus should be on reversal. And once we commit to reversal, we must understand that it's not about limiting healthy minerals and protein. These are essential nutrients we need. We need the protein, we need the fat, we need all the beneficial building blocks to rebuild tissue. What we need to eliminate is the primary interfering factor, which is high insulin levels that drive kidney failure, hypertension, and the entire metabolic syndrome. If you found this video valuable, you are absolutely going to love that one next. And if you truly want to master your health by understanding how your body really works, make sure you subscribe, hit that bell icon, and turn on all notifications so you never miss another life-saving video.